As we continue to track COVID-19 in Tennessee, some troubling news as health officials have likely identified a case of the Brazilian variant of COVID-19 in our state. While lab results are still confirmed, we take a deeper dive into what researchers know about this strain. News 2's Valencia Wicker breaks down the facts learned so far.
As experts work to analyze a variant of COVID-19 discovered in England, researchers now have a second strain on their hands, this one from Brazil.
If you think about it kind of like the influenza virus, when these viruses multiply, they can mutate, and that means their surface can change a little bit. And both this British virus and the one in Brazil have surface changes that are a little different from the parent.
Dr. Schaffner of Vanderbilt University Medical Center says the new Brazilian variant presents symptoms much like the COVID-19 parent strain, but this one tends to develop at a more rapid rate.
What we know about this Brazilian variant is that it spreads readily, we know that, and it looks as though with tests in the laboratory that our current vaccines will provide very substantial protection against it.
Schaffner says the average nasal swab COVID test cannot distinguish between strains. That's why state officials are taking specimens to labs for more in-depth testing.
My understanding is we're not just doing a random sampling. We're looking for circumstances that are a little different. If individuals, for example, think they have a reinfection, a second infection, or if there's a cluster of infections in a community where there's an awful lot of very rapid spread, that might be an occasion where you get a bunch of those specimens and test them.
He says variants of COVID-19 are a clear indication that the virus can mutate several times over and will likely be around for the foreseeable future. In Nashville, Valencia Wicker, News 2.
News 2 reached out to the Tennessee Department of Health for more information on how they are testing for these variants. We've not heard back yet.